do you mind introducing yourself and giving your job title, please? Mhm.
Yeah, sure. So, my name is Emily, and I'm a first-time mum to my son, and he is now 4.5 months old. So, has been obviously born in the last year during the pandemic. But I'm also a mental health nurse by trade, and I work in a specialist team, a perinatal service, who work with mums, families, babies who are at risk or who are severely mentally unwell during the perinatal period.
Mm. Thank you so much. And with it being Maternal Mental Health Week, I was wondering if you could talk about some of the challenges that some moms would face during the perinatal period. Yes.
Yeah. So I think family is incredibly different to what it used to be. I know that I'm in terms of England, I'm a southern girl that now lives in the north. So all of my family and friends live down south. So that in itself can be an incredibly lonely time. And if I were to develop any sort of mental health difficulties, the most common being sort of depression and anxiety, that there would be very few people that know me really well that either I would be able to reach out to or who would be able to see those signs. So speaking in terms of my setup, that would be some of the risks for me. I think some of the risks that I'm really aware of in terms of the job that I do is people feeling like they can come forward, whether that's, the mum directly or family members around her that might be worried or concerned because we just, if for some reason, inherently live in fear that our children are at risk of being taken away from us because we're not good enough, we're not doing the right things, we don't have the right pram, we don't have the right look, um, we don't have the right level of self-esteem to raise healthy, happy children, which on the whole, the population do. It's just our brains tell us otherwise and fear that we're never going to be good enough and that our kids will be taken away. So that's been my experience, that people struggle to get the help that they need, whether that's from the mild to moderate to severe um, illnesses that can happen in the perinatal period. And then the hurdles of whether that's getting to your GP and then having a GP that understands or knows where to go. Um, and even just in that moment, actually having a long enough appointment to feel safe enough to get to that conversation. Um, I know that my postnatal 6-week check was pretty brief, and yeah, probably could have been a bit better. And obviously, I did give that feedback, and hopefully that'll improve. But yeah, many challenges for
Mm.
women and families to come forward, I think.
Thank you so much. I think you talked a lot about, you gave a lot of description about the alienation that one might feel being separated from family and the pressures of not being good enough or feeling that they just don't have the capacity and of worry about the judgment and stigma and the fear. And that you really described so much in terms of a spectrum. And I was just wondering what you might have to say about maybe some dads or partners kind of experiencing their struggle, and maybe you could kind of shed light on some of that for our listeners today.
Yeah, I mean, in respect of the team that I work in, we're pretty shiny and new. There's some areas of the country that have been running much longer, but of course, if my memory serves me right, we're only about 3 years in, and when we started, we were acutely aware that we were set up for mums,
Mm.
and it was only because of what is called the carers provision in mental health care that we were able to offer anything, if only a small assessment service, which then would be followed by referrals to other appropriate agencies for partners. That yeah, there's just not a lot for them, and I'm in North Yorkshire, so there's some real isolated and deprived areas around here. So the need is hard to get on anyone's agenda, and then the sparsity of land in between families and setting up sort of local communities and groups for partners to just even get that peer support, let alone a professional team of clinicians to support partners, is really hard. So and focus, when we think about the antenatal period, not just in COVID times, but made worse by COVID, actually, because my partner wasn't able to come to any of my antenatal appointments until the very end, just due to the timings of how we were trying to cope with the pandemic. Yeah, they're just not there, and they're not thought of. That might be a bit unfair, but it felt like that as a couple anyway. So he would have had no in route to speak to somebody about himself, or if he was worried about me. But yeah, services are incredibly geared. And to a degree, I understand why, but for mums. So there's very little sort of entry routes for dads. Dads, anyway, they're not always the most forthcoming in terms of their being able to talk about that. So to have very, very few points of entry can sometimes, I would imagine, make it feel nigh on impossible for the dads. But partners in general, yeah, not many ways in my experience.
Yeah. So you're talking about kind of barriers to accessing mental health for dads. I'm just wondering if you could maybe just describe what would be some of the signs to kind of look out for. What would be on the radar if one was concerned for dads? What kind of signs to look out for during this perinatal period with mom?
Yeah, I guess that there can be an element of withdrawal, a lot, and I'm talking in stereotypes again, but they do have their uses at times. But everybody is individual. But increased use of drink, or any recreational drug use, or change in temperament. A lot of expressions of anger and frustration sometimes. Yeah, I think they would be the most earliest signs. My little man wants to play with the laptop. It's not happening, kid. Yeah.
Thanks so much. And I'm just wondering, what would you say to a mom who is struggling right now, or a mom and partner who are struggling during this period? What would be your thoughts, or kind of, yeah, what would you say?
I think I would say just really try as hard as it is to speak up as early as you can, because there are services out there. It may not feel like they're always easy to find, or it may not feel that they are at the fingertips of your GP, which for most people is the first contact. But there are people out there ready and willing and wanting to support you in the difficulties you may be facing. And intrusive thoughts tend to be one of the most common things that us as a team experienced, and we are at the severe end. But just even from my own experiences being a mum, I've had some really scary and some really frightening thoughts about my baby and what could or might happen to them, which in your own head might seem really far-fetched, but it's really, really common across the majority of parents. I think the last thing I read, it's about 80% of parents, mums, dads, partners, who do experience those intrusive thoughts. Just because you think them, it doesn't mean you want to do them. It doesn't mean that they're going to happen, but it can feel really, really frightening. So people are not going to judge you. You will find, if you're able to speak out, that you will probably be in similar company of people that have experienced the same thing. So the sooner you can get out there and speak to somebody, the better it will get. And they do stop.
Yeah. And then I'm just wondering if you would be okay to kind of describe a little bit about your own experience having a baby in lockdown, being a first-time mom, and also having that kind of knowledge and awareness about mental health, and specifically that you work in a perinatal mental health team. I was just wondering about that dual role, and if you could kind of maybe shed a little bit of light about that experience and how that's shaped you. Mm-hmm.
Yeah, I think I think it's pretty mixed actually. I know, especially from my experience as a family member and as a practitioner, that there's a real, sometimes for some people, a real intense need and want for people to come and visit you immediately once the baby arrives. And a little silver lining of COVID meant that that couldn't happen, and it protected a sense of time and space for me and my partner and my son. To survive those first few weeks of brutal sleep deprivation and attempts at breastfeeding and all the joys and wonders of parenthood. But there were also times where it was really lonely. You know, my partner is pretty in the same average situation as most people, got 2 weeks paternity leave and went back to work, and there were no groups, there were no sort of informal mums meetups, walks that I could go on, none of that. So yeah, I'm really thankful that restrictions are lifting right now, because I think had it gone on much longer, I would quite rightly be accessing services in the way that I've just encouraged other families to do, because it was getting difficult. And I'm a pretty family orientated person at the best of times anyway, so I want them to meet my son. In terms of being a practitioner and a first time mum, I guess sometimes too much knowledge can not always be easy, but I have somehow managed to balance that with a level of comfort. I think, like I was giving an example about intrusive thoughts, they're horrible, and I was optimistic to bypass them, but I didn't. But I knew that it was common. I knew that I would be okay, and I knew because those thoughts were in my head, it didn't mean that I was going to do anything to my son, and I knew on the whole that, you know, apart from, you know, bumping his head and the joys of teething, he wasn't going to experience any pain. So yeah, it's been pretty mixed, I guess, going right back to the antenatal period. He's my first child, but he's my partner's second. So not being able to come to the scans and come to those appointments, at least he tells me, didn't feel as harsh for him because he has done it before. Obviously, he would have liked that to have been there. And I didn't have anything to compare it to. So, and we were very lucky on the whole throughout the pregnancy not to experience any real bad news. So I just have to be very thankful for that, I guess, that I never had to be on my own experience in that. But I think they will hopefully be some very serious reflections that services will have in terms of, hopefully this never happening in the future, but if any similar, you know, changes in service need to happen, that they will be thought about a lot more, or things will be put in place a lot more differently than what they have been this time, for mums having that kind of news. Did I answer every component of that question?
Yeah, absolutely. I think you gave a real personal experience, and is, you know, quite, it will hit with so many listeners, especially with COVID and the impact that's had. And thank you so much for your thoughts today. I'm very hopeful, and I have absolute confidence that our readers and listeners will be greatly impacted by this. Thank you so much.
Not at all. Obviously, he wants to be part of it, so that was him just joining in for the end.